How do I know if my child needs ABA therapy or traditional therapy services?
I genuinely believe my siblings could have benefited from a mixture of both mental health and behavioral health. It's not maybe just the child that needs mental health services, but the family might need support.
Many families wait months before they actually reach out to help. Why do you think people wait to reach out? One of the biggest questions families may ask is, how do I know if my child needs ABA therapy or traditional therapy services?
If I was posed that question, how would I answer? That is a really good question, right? Well, I think things that we want to consider, right? I think a lot of the times, and I say this as a BCBA because I've worked with a lot of BCBAs, we do ourselves a disservice of saying like, no, our kids, like, they just need ABA, right? Without realizing a lot of the times, specifically the families that we tend to service, right? So, and like even myself, like coming from my background, like I genuinely believe my siblings could have benefited from a mixture of both mental health and behavioral health, right? Because with ABA, we understand, right? Our goal is to look at behaviors that we can see, right? We're not diving into like what's happening, like what's going on mentally. What are those things? And there's a big move that's happening where we are starting to work to put that together. But throughout the history of ABA, our goal has consistently been, is it measurable? Is it observable? Can we track it? Are we able to graph it? Great. Okay, so now we work on that behavior, right? But a lot of the things that often also impede and create behaviors also come from mental health concerns, mental health support that is needed, right? Because we also have to think about one child comes from a whole family dynamic, right? And all that family dynamic is also impacting that child. So it's not maybe just the child that needs mental health services, but the family might need support, right? The parent, the siblings, right? So all of this just really truly comes together as, a whole service that should be working together to support each other in terms of the things that we're not able to see and maybe the things that maybe we don't understand effectively. Somebody in the field of mental health is able to give us insight, and both ways, right? So I think that's kind of how I would answer that. Yeah.
I really like that answer. I was actually an ABA therapist for a while, so I like that I'm able to see both sides too. I would actually use the rule out method. So in therapy, we do this thing where we look for the most pressing concern. And if you start recognizing symptoms of autistic on the spectrum or even ADHD, like you want to get that rule out to see how much it's impacting their lifestyle, right? If the autism on high, like what is it called?
Level 3?
Yes. So if it's a higher level for autism, no, you don't want to focus on mental health therapy. You want to focus on the ABA therapy because the ABA therapy is going to dive directly in, like she said, with the skill building, the behaviors, the positive reinforcement, negative reinforcement. They're going to focus on that to help the individual with the behaviors in itself. With mental health, yes, we focus on the cognition, right? So how does your mind, your feelings, and your behaviors work? And then we work on changing those behaviors. But you can't work with individuals on the spectrum and changing those behaviors through their cognition if they're not connected anyways, right? So I think it would be a rule out to focus on the pressing issue first and then introduce, like Yamile said, introduce the family to mental health therapy. There's a big imbalance in the household when it comes to mental health issues because it's always centered around that one person. So like she mentioned, the dynamics in the family household being affected, it really, truly is. And that's why I like the CYBHI program is because it focuses on that. So the family can feel heard, the siblings can feel heard, the parents don't feel like it's all on them because it's something that they don't understand in terms of the ABA or do I need ABA, do I need mental health? Go to a professional to determine that for you. So you don't have to determine that. They will be able to recognize, hey, are these symptoms related to the spectrum? I'm going to refer you to an assessment, right? Once you get that assessment, then they'll refer you and get the ABA services and then also refer your family to get the mental health treatment.
For families who may not know, what does an LMFT do?
So LMFT stands for Licensed Marriage and Family Therapy. We focus on the family structure in itself. Ours is just in the household. An LCSW is mostly going to focus on social working. So they're going to connect you to resources outside of the home, right? You also have a LPCC that is going to focus on counseling. So they're right in between LMFT and LCSW.
Yamile, for families who may not know, What exactly does a BCBA do?
Yeah, so a board certified behavior analyst is somebody that focuses on behaviors, skill development, and life skills. Our ultimate, goal is we are analyzing, whether it's behavior reduction, skill acquisition, life skill development, and we're measuring to determine where our kiddos fall, adults, because we work with a wide range of ages, where they fall within, skill based assessments, right? So determining, are they at age range, or are they a little below? If there's, some discrepancies, that's when we determine what are the skills that we're working on developing. Yeah.
When would you consider the cutoff between when someone can benefit from ABA services versus traditional therapy services, and then what situation do you work around both?
So in terms of what Yamile said earlier, once they get to the skill development, once they've already reached, hey, ABA is working with them in terms of the behaviors, they were able to, help implement a lot of those changes, and then now they're on the skill development, they can start mental health therapy to focus on their cognition. ABA and mental health therapy is going to help them with that communication so they know how to communicate and whatnot. And that's why I think once they get to the skill developing level, they can actually transition into mental health. In terms of the cutoff, I would never cut off mental health therapy. I think I would leave it open so that's an option for them to always come back. Like she said, Yamile said earlier, ABA is a constant learning field. Well, so is mental health therapy, and we have to have training, every year we collect what's called CEUs so that we can constantly train on the new things that are coming in the field.
Yamile and Dr. Green, can ABA and therapy services work together? And if so, do you typically see a different type of outcome?
A lot of it is based on processes, right? Because especially we're talking about it's easy for us to sit down and have a conversation, right? But then we have all the ethical stuff, all of the, insurance, depending on the insurance, there's specific processes that do have to happen, right? But let's say I have a client and maybe the parent might benefit from mental health services and or the client, right? It all initiates with a conversation with the parent, right? Because obviously you can't force something. It's having a conversation, letting them know hey, these are maybe some things that might be of support. These are some resources that might help, right? Which that's the initial conversation, right? Let's say they begin services, mental health services. Then from there, it's having a conversation with the parent to confirm that it's okay for us to share information, which is the release of information that would need to be signed to authorize that we can have a conversation and share information about the client. That would be kind of the overall basic process for that. Yeah.
I really have, like I said, the feedback means everything. It's interesting for the parents to recognize that the other siblings and children didn't feel heard and didn't feel seen because everything was centered around this one child. It's also beneficial because once we do start the individual therapy, they don't know what to say because they were never heard, right? So they are like, okay, I don't just tell me what to talk about. No, I want to hear from you. And eventually they do start talking. And the good thing about this CYBHI program is that it doesn't stop at the free therapy services. Because with True Escape, we're credentialed with 11 different insurances on top of our 3 contracts. They can transition out of the free services once they're done with their 5 and just continue individual therapy sessions. And that's what a lot of the children are doing and the parents. So it benefits the whole household, and the feedback is telling us, hey, this is needed within the community, right? So on top of the ABA therapy services, we're also offering the mental health services, and then the whole family feels seen. The other thing that I really like about this program is it doesn't just focus on the individual sessions. We also offer them an additional family session. The family session, when they come together, they're able to see the growth in each other themselves. And that is everything to me because they're lighting up like, my daughter is talking, right? Like my son is saying that, my son is giving feedback. One family, they were so happy they ate dinner together at the table. Like, I know that's not big for some people, but when you learn these families and how separate they were in the same household, sitting in the rooms, eating on their beds, like, that was so powerful. So hopefully I answered the question.
Oh, no, you answered the question. Yeah. So I want to talk about a real life, we'll throw out a couple of real life family scenarios. So imagine that we had a parent listening today, and this parent had an 8-year-old kid, and this 8-year-old kid was having meltdowns at school, struggling with making friendships, and they don't know, the family doesn't know where to turn for help. Can you walk us through from the lenses of a BCBA and a ABA focused program? What would be the next step on your role in helping this family?
My next step would be, I think it's really tricky because it's really about information, right? So I think this is where outreach, information and resource sharing is so important, right? Because this family can go on for years like this without like being aware that, hey, like there's a service, there's there's a variety of services, in fact, that you could seek and you can access, right? So I think with that, is making them familiar, making them aware of the services. And it all starts with, going to their primary care provider and requesting for, some type of assessment, whether it be, a behavioral health assessment. Like there's a variety of assessments that can be done, to then determine if maybe there's a diagnosis, maybe there's like, mental health concerns, maybe there is other services that might be needed. So that is where all things would start to then transition to maybe we get a referral and we can start, the initial process of the referral.
Awesome. Thank you. And from the lenses of a LMFT and traditional therapy, what would be your perspective?
To answer that question, because it involves an 8-year-old child, every school now has what's called a Care Solis program, Care Solis, SOLACE. With the Care Solis program, they're connected to a bunch of different programs within the community for mental health therapy, psychiatry, even ABA therapy, where they can connect you out. And they don't pay nothing, anything like that. All they do is connect to resources. So if an individual doesn't know where to look, the school is going to find it for you. Like if that individual is causing behaviors or implementing behaviors, anything like that, the school is going to call you, and then the school is going to offer you the Care Solis, right? Now, once they do that, the school will ask them if they want to give us their information. The parent will then agree to it. The Solis program then calls those different centers and provides them with the parents' information. And then our program, I have an admin team. So my admin team does everything. They'll reach out to the families. They'll immediately schedule them for an assessment, or not an assessment, an admin like assessment background, where they collect their geographical information. They sign different consent forms. They fill out an intake form to show why they're coming to therapy, what services they need. Most of the time, it will show that they were referred from the Care Solis program. And then we just start from there. After the consent forms are signed and they complete the intake information, we get their insurance. And then they can either schedule a consultation, to meet with one of our therapists. They can familiarize themselves with our therapist online, because all of our therapist bios are online, including our admin team, just so when they walk in the office, they're very familiar with every staff person there. But the consultation is free. They can schedule a consultation to just get to know with them, see if the vibe is there, if they want to connect with them. We have 5 therapists, so if that therapist doesn't work with them, they can work with someone else. Also, with that intake, the initial intake, we're able to determine if we can even help them, right? So if they come, like Yamile said, and say they have additional issues, and we notice that some of these symptoms are related to the spectrum, we're not even going to see them. We're going to immediately refer them out and let them know that they can be better served in this area.
In the Care Solis, I hope I'm pronouncing it correct, the Care Solis program, is that a statewide program, or is that a San Bernardino County or Riverside County program?
That is a great question. I will get back to you on that. I don't know. I just know that we are connected in the high desert. So I don't know if it's San Bernardino County. I don't know if it's Riverside County, but we are listed. True Escape is listed on the Care Solis program, along with a bunch of other programs. But I can look into that and let you know.
That is a great program. I think it's a much so needed program because, we talk about no children being left behind, and this is a definite example on how we can help children access the services that are needed. And my follow-up question just will be is, if a family did feel overwhelmed and doesn't know where to turn, what would be your input for any listener that does feel overwhelmed with their child's behavior, mental health status, or lack of help? What would you say? So
either ask for help or don't. So here's the 2 scenarios. Don't ask for help, and then help is going to find you either through the cops, through the school, through the courts, right? Or you can ask for help and say, hey, this is what I'm looking at my home. Who else is experiencing this? This generation has it easy because there's social media, there's ChatGPT, there's Hey Google. You know what I mean? So if you have something going on in your home, hey Google, do I need help? Hey Google, what does this symptom mean? People go to Dr. Google all the time. Well, use that and then determine if you actually need help. I would really, really not like it for somebody to experience some detrimental pain because they didn't ask for help. So that's my biggest advice to parents. Either ask for it or don't. Either way, it's going to come to you.
That's a great answer. Yumile, what do you say?
I mean, yeah, exactly that. Yes. It's always going to find you. I mean, and you're right. Like, it's either going to come through the school because the school's going to let you know, like, hey, this is a problem. It's going to happen in the streets because the streets are going to find the problem, or you're going to make the decision to like, okay, this is not the type of behavior that is typical for a child this age, you know?
Yeah, so, we'll talk about breaking the stigma a little bit. Many families wait months, years before they actually reach out to help. Why do you think people wait to reach out?
I think it's safer to keep everything in home. It was very prevalent in a lot of colored communities, right? And nothing left the house. Everything stays in home and everything happens in home. And that's where they had a lot of abuse, because nobody was talking about it. So it's safer to keep it in the house than to take it out somewhere else. And then that's why people are in the position that they're in, because now they get older. And like I said before, either they ask or they don't ask. Now their child is a lot older and they're responsible for their own behaviors.
I think it's kind of, coming from a Hispanic household, it's very much the same, right? Culturally, we kind of keep things in home. And then there's also the concept of, I don't know, so I just don't know, right? And I think this was like a very long-lived experience for me as well, specifically with my older brother that he is 30-something now. And, it was very much that it was the unknown, right? And then it's unknown, so we don't really know what to do, and we're just going to follow whatever people that I'm assuming that know. I'm going to follow what they tell me, right? And I think that's another, I guess a segue to something else, right? To also question the people that know, because sometimes the people that know don't always know, and you kind of have to be the advocate of finding the correct resources and the correct help. So,
and what would you both say, to a parent that says if they have to sit across from you or sit across from you that they failed?
You can't fail on something that you don't know, right? So the fact that they're sitting across from us shows that they didn't fail because you're here, right? So usually if parents feel like they failed, that's because they're feeling guilty. They're feeling shameful. I let it get this far. Well, you didn't know, but now you're here. So I would really redirect that to focus on the here and now and then move forward.
Just as an industry, how can we normalize reaching out for behavioral mental health services?
I think it all starts with really us, right? Putting the information out there, having safe spaces to share the information, being approachable, right? Being, true advocates, not just for the things that we want, but also when we have an opportunity to speak on something and provide the information and provide the resources. I think that's where it all comes from, right? Because if it's same social media, right? There's all these trendy dances and all that stuff, right? And it's out there and people see it. So then everybody's like, oh, we want to hop on that, right? So same thing, right? We make, mental health and behavioral health, make it trendy, make it, out there, make it, something that it doesn't hold such a big stigmatism, a big stigma, on it. It really creates that, that ability for people to feel comfortable to seek the services.